Be 2 weeks ready. Unit 7. Follow along on Toolkit, page 27.
Unit 7, First Aid Plan. After a disaster, the emergency medical system will be in high demand and help may be delayed. Learning how to treat different injuries and illnesses can prepare you and the people you care about and help save lives. You are the help until the help arrives. Quick start steps. The 3 P's of first aid. Build a first aid kit. Oregon's Good Samaritan Law. The 3 P's of first aid. First, preserve life. Starting with CAB, circulation, airway, and breathing. Assess the quality of the injured person's circulation and adjust if needed. Ensure the injured person has no blocks to their airway and their breathing. Second, prevent deterioration. Do what you can to keep the injured person in stable condition. This may mean moving them to a safer location, applying first aid, stabilizing them, or just staying with them and providing comfort. Promote recovery. Encourage confidence, provide comfort, and attempt to relieve pain. Build a first aid kit. An important part of being 2 weeks ready is having first aid supplies organized and ready to use quickly. While a store-bought first aid kit is an easy way to start, it can be more cost-effective to build your own. The American Red Cross recommends that all first aid kits include the following: compress dressings, 5 by 9 inches, adhesive bandages of assorted sizes, adhesive cloth tape, antibiotic ointment packets, antiseptic wipe packets, aspirin, emergency blanket, breathing barrier with one-way valve, instant cold compress, non-latex gloves, size large, hydrocortisone ointment packets, 3-inch gauze roll, sterile gauze pads, 3 by 3 inches, oral thermometer, non-mercury, triangular bandages, tweezers, and emergency first aid instructions. This is not a complete list, and you may need to add additional supplies based on your household's needs. You'll want to keep a first aid kit in your dwelling, vehicle, and go bag. Consider getting your friends and neighbors involved to offset the cost by buying in bulk and sharing supplies. Oregon's Good Samaritan Law. Oregon's Good Samaritan Law protects you from liability when rendering emergency medical assistance. Ask permission to help an injured or sick person. If they are confused or critically injured or ill, you can assume that they would want you to help them. This is known as implied consent. Activities are on pages 83 through 86.